Okay, everybody, welcome to the second installment of the lab test review for the skeletal system. This is the installment dealing with the appendicular skeleton, which includes the pectoral and pelvic girdle and the bones of the upper and lower limbs. And again, we caution you not to use these video podcasts as a substitute for going to biosis and actually interacting with the models. Again, realize that the questions from the practical will be constructed from the bones that you were working with the past week when you were studying the axial skeleton. This is simply meant as a supplement to the material that you can use to prepare for the exam. So, first question we have, identify the bones seen on each of the following slides. Okay, so which bone is which? Now this is going to be a little bit of a challenge because this is a two-dimensional representation of a three-dimensional object, but let's just take 10 seconds and see how well you do. Okay, so let's start with the leftmost bone, the bone over here, okay, and draw a circle around it. What is this bone? Okay, well, this is the longest and strongest bone in the body. This is the femur, okay, and this is in particular a left femur. Now, how was I able to tell a left femur from a right femur? Well, one of the things that you'll notice is that the surface that's down here near the distal head, this is the distal head of the femur, is smooth, okay, and you can't see the intercondylar fossa from the anterior aspect of the femur. So this is the left femur, okay. Another thing that you'll notice is that you cannot see both trochanters from the anterior aspect, and another clue that will give this away as a left femur versus a right is that the femur bows somewhat anteriorly outward. Okay, so it's concave outward anteriorly. Okay, what is this bone here? Okay, well, this is the radius, and how can you tell? Well, it's the only bone in the body that has a proximal head that's shaped exactly like a dime. Okay, and that's because it needs to roll over the ulna when you pronate and supinate. This is a left radius. How can you tell? Remember that the radius is on the thumb side of the forearm, okay, and that the proximal head is going to basically interface with the radial notch. Okay, so this is the proximal head. The radial notch is a little indentation on the ulna. Remember that the radius is going to, with the styloid process here, which is going to be on the lateral side of the radius, form the outside bump of the wrist. Okay, the styloid process of the radius right here. Okay, so this is a left radius, Okay, another giveaway is the tuberosity. This little structure right here. All right, and that is always going to be on the medial side of the radius. Okay, so a left radius right there. Okay, remember that's the lateral bone of your forearm. Okay, what is this bone here? This is an ulna. Okay, the way you can tell it's an ulna is it has a proximal head that's shaped like a U, looks just like a crescent wrench, and the way that you tell a right from a left ulna is you look for this structure right here, okay, which is called the radial notch. The radial notch is always going to be on the lateral side of the proximal head of the ulna, okay? So that is a left ulna. Remember, the ulna is the medial bone of your forearm, the medial bone. The styloid process of the ulna, this little sucker down here, it forms the bump on the medial side of your wrist in anatomical position. Okay, Moving on, we want to ask, okay, what is this bone right here? Okay, and this is a humerus, and this is a left humerus. Now, how was I able to tell that it's a left humerus? Well, it's a couple of giveaways. Okay, number one, this indentation called the olecranon fossa is much deeper than the fossa on the other side, which is for the coronoid process of the ulna. Okay, so we know that this is the back of this bone that we're looking at. Okay, another thing that you can note up here by the proximal head is that there's no greater and lesser tubercle. The greater and lesser tubercle have a groove that runs between them through which the tendon of the biceps brachii runs. Okay, so this is the back of this bone, and so this is a left humerus. A left humerus. Okay, now what is this bone here? This is a fibula. Now this is a little tougher. Fibula is one of the more difficult bones to distinguish right from left, but you can distinguish proximal from distal. The proximal head of the fibula is going to have more of a blunted off appearance, and it's going to have a little bit of a sort of a pointy process at its proximal aspect, whereas the lateral malleolus, okay, remember that the fibula is the lateral strut of your lower leg, is going to be smooth on the lateral surface, and it's going to point posteriorly, okay, like that, and inferiorly down, okay. So this is a right fibula, a right fibula. Okay, what bones are these? Okay, let's give you 10 seconds. Okay, this is an os coxa. This is one of the two bones of the hip, and it is a left os coxa. Now, how do I know that it's a left os coxa? Well, there's a couple of giveaways here. Number one, this indentation is called the acetabulum. Okay, the acetabulum is where the proximal head of the femur articulates. Okay, so this is what forms your hip joint, and it's always going to be on the lateral aspect of the bone. Okay, so you're looking here at the lateral aspect. The other giveaway that tells you front from back are the greater sciatic notch, which is always on the posterior aspect of the os coxa, and the pubis, which is the bone that's in the front. Okay, so this is the pubis, and this here is the ischium. Okay, this is the part that you sit on when you sit. Okay, so this would be the front, and this would be the back. Okay, what articulates medially at the posterior aspect of the os coxa is the sacrum, and anteriorly at the pubic symphysis here, the os coxa articulates with the other os coxa to form a joint called the pubic symphysis. Okay, so left os coxa. Let's put an L there so you remember. Okay, all right. What is this bone here? Okay, well this is the tibia. Now, is it a right or a left tibia? It is a left tibia. Now, how can I tell? Well, a couple of giveaways for the tibia. One of the things that you'll notice is that there's a little bump on the proximal anterior aspect of the tibia called the tibial tuberosity. That's where the patellar tendon attaches. Okay, so we know that this is the front of the tibia, and we also know by looking at the distal head that the medial malleolus is going to be obviously on the medial side of the ankle. Okay, that's the bump on the inside of your ankle. So we know, since this has to be on the medial side, that this has to be a left tibia. A left tibia. Okay. The tibia articulates distally with the talus, and it articulates proximally with the femur. Okay. We want to identify the indicated bones. Okay, so on the top here, these guys, These are the carpals. Okay, I'll circle them. Okay. All right, what are these bones here? These are the metacarpals. Okay, these are the bones of the palm of your hand. And then finally, what are the bones that are the most distal? This group of bones here. These are the phalanges. The phalanges. Okay. Now notice that the thumb, which is indicated as digit 1, this is digit 2, 3, 4, and 5, the thumb has only a distal and a proximal phalange, while the rest of the fingers have a distal, middle, and a proximal phalange. Okay, they articulate, the proximal phalange articulates proximally with the metacarpal, and the metacarpals articulate proximally with the carpals, okay, which articulate proximally with the radius and the ulna. All right, you have to be able to answer questions that ask it in just that way. Articulate means forms the joint with. Okay. Okay. What are some of these indicated bones? And I'll give you 10 seconds. Okay. Let's start with this guy. This guy has a smooth a smooth superior surface, and this is the talus. The talus articulates proximally with the tibia and the fibula. Okay, what are these bones here? Okay, these are the metatarsals. Okay, the metatarsals are the bones of the sole of your foot. All right. All right, what are these guys here? These are your toe bones, known as your phalanges. Just like in your hand, you have phalanges as your finger bones. In the foot, you have phalanges as the toe bones. Okay, finally, what is this bone here? Okay, that is the calcaneus or heel bone. And then, lastly, what's this group of bones here? Those are the tarsals. The tarsals, okay? Now, is this a left or a right foot? Good question. Okay, how can you tell? Well, number one, you know that your little toe is always going to go on the lateral side of your foot. Okay, so this has to be lateral. Now, how do you tell top from bottom? Well, the talus is going to have a very smooth surface. Okay, a very smooth surface because it articulates with the tibia and the fibula, whereas the calcaneus is going to have a very rough surface. So that will tell you top from bottom. The little toe will tell you lateral from distal. Okay, so this is a right foot. Okay, a right foot. Let's put an R there so we remember. R for right. Okay. All right. Moving on. Whoops. Which of the bones seen here are shown in a posterior view? Okay. Well, first of all, let's take 10 seconds and see if you can identify which bones those are. Okay. All right, let's go through each one. This is an ulna. Okay, how can you tell? Proximal head shaped like a U. This is a femur. How can you tell? Femur is the longest and strongest bone in the body, and it features a process called the greater and the lesser trochanter, which are clearly visible from the posterior aspect. Okay? All right. And which bone is this? This is a humerus. Okay? So ulna, femur, humerus. Okay? Now, of these, which are we looking at from the back? From the back. Okay. Well, let's start with the ulna. The ulna, remember, is the medial bone of your forearm. And so, if you think about anatomical position, okay, the proximal head of the ulna, this guy up here, is going to articulate with the humerus, okay? The bump on your elbow is going to be formed by the back side of this protrusion, which is called the olecranon process. Okay, and he's going to fit into a groove, a little depression called the olecranon fossa, and that's going to be on the distal head of the humerus. Okay, so we have to be looking at this bone from the front because we can see the indentation here, and I'll kind of trace it, the indentation, which is the the trochlear notch. Okay, the trochlear notch you're only going to be able to see from the front of the bone. Okay, so this bone is present in an anterior view. All right. This is the femur. Okay. Now the femur has a couple of giveaways that'll tell you front from back. All right. The easiest one is at the distal head. Okay, this is the distal head of the femur down here. And the distal head features a little indentation between the condyles, which is called the intercondylar fossa. You can't see that from the front of the femur. All right, so this has to be a posterior view. Another giveaway is the greater and lesser trochanter. You can't see both of these trochanters from the front. Okay, you can only see them from the back. There's the greater trochanter, all right, and there is the lesser trochanter. Okay, so this tells you that this is a posterior view, so this is a right femur, because the proximal head is always going to project in a medial direction, Okay, how about this bone? This is the humerus, okay? Now how can I tell whether I'm looking at the front or the back of the humerus here? Well, if you look at the distal head, okay, we can turn it over, all right, and you'll have the bones to turn over in the actual practical. And what you'll see with the distal head is that the back of the distal head, the posterior view, is going to have a much deeper groove, much deeper pocket right here than the anterior portion of the distal head. Okay, this is the olecranon fossa. This is what accommodates the olecranon, this little protrusion up here. Okay, so the bump of your elbow kind of fits into this pocket. All right, so this is the back of the humerus. So this is a left humerus. Now another giveaway is that we cannot see the greater and lesser tubercle up here by the proximal head. Okay, remember that the groove between the greater and lesser tubercle, called the intertubercular groove, is missing on the back. You don't see it. It's basically an area through which the head of the tendon of the biceps brachii runs. Okay, so this is a posterior view. All right. Okay, here we have a slide asking us which of these bones are from the right side of the body and which are from the left side of the body. Okay, on the right side of the body, what we should do is just take a survey of each of these bones, name them, and then look at the relevant features. So the bone up at the top, this is a humerus. Okay, now are we looking at the front or the back of the humerus? And here we're looking at the anterior aspect of the humerus. So we're looking at the humerus from the front. Here is a femur. Okay, are we looking at the front or the back of the femur? And we're looking at the anterior aspect here of the femur. All right. Down here is the scapula. Are we looking at the front or the back of the scapula? We're looking at the posterior aspect of the scapula. And then finally, down here is an os coxa, and the question is, are we looking at the front or the back of the os coxa from this view right here? Okay, so this is the posterior of the os coxa, and this is the anterior up here. All right, and this is the acetabulum, so this is the lateral aspect. This would be the medial aspect. Now let's go back to these other bones and figure out why it was we were able to orient them the way we did. Remember, looking at the humerus, one of the things that we look for is the intertubercular groove and the greater and lesser tubercle, which we can see up here near the proximal head. Okay, so what that tells us is that we're looking at the front of the humerus, and since the head always projects on the proximal end medially, this has to be a left humerus, okay? For the femur, we know that we're looking at the front, and it's the same with the femur as it is for the humerus. The proximal head has to project medially, and we know that this is the front of the femur because, again, at the distal head, we see a very smooth surface and we see no intercondylar fossa. So this has to be a left femur, okay? How about the scapula? Well, we know this is the posterior of the scapula. We know that the glenoid fossa, this little area right here, this has to be on the lateral side, all right? So this has to be a left scapula, So let's tag these. Left, left, left. Okay, now how about this os coxa down here? This is the back of the os coxa, and this is the front. And we know that the acetabulum is on the lateral aspect. So the question is this a right or a left os coxa? And it is a right os coxa. And again, we can tell that because there's the greater sciatic notch on the posterior side, and the pubis would be up here on the anterior. So this has to be a right os coxa. So we'll put an R right here. Okay, R. All right. So left for the humerus, left for the femur, left for the scapula, and right for the os coxa. Okay. Which view, 1 or 2, is the anterior view of this bone? Okay. So how do I tell that? Well, first of all, what bone is this? Okay. Well, this bone is the humerus. All right. Now, how do I tell the front from the back of the humerus? Well, again, I have to look very carefully at the proximal and the distal head. Now, if I look here at the distal head, okay, this is the distal head of the humerus here. This is the distal head of the humerus in this view, okay. Now, which one has the deeper groove? Well, the deeper groove is here, okay. The deeper groove is here. So this has to be the posterior view. This is the posterior view, which makes this the anterior view, and we can see here the intertubercular groove right there. All right. So view number 1 is the ventral view of the bone. Okay. Okay. The ventral view here. All right. Moving on. Identify the bone markings in this next set. Okay. First of all, what bone is this? Okay. This is the scapula. First of all, which scapula is this? Is a left or a right? This is a left scapula. A left scapula. Okay. So left. Okay. Which end is the lateral end and which end is the medial end? Well, this is the medial end. Okay. This is the lateral end. Okay. And we're looking at a posterior view. So, what are these different processes? Well, the acromion process is this guy here. Now, how do I remember the acromion process as this process on the back of the scapula? Well, I think about your front and your back, right? Your ass is in the back of your body, okay? The acromion process starts with the same letter as ass starts with, so the acromion process is on the ass of the scapula, which is at this back end of this ridge called the scapular spine, okay? So that's how I always remember acromion process from the other process up here, which is the coracoid process. Okay, how about this little indentation here? This is what articulates with the proximal head of the humerus. This is the glenoid fossa. All right. Now, what about this big indentation right here? Okay, what is that? That is the infraspinous fossa. It's called that because it's below the spine, and this guy up here is the supraspinous fossa. Okay, and the muscles that sit in them bear the same names. The supraspinatus sits in this little pocket, and the infraspinatus sits in this little pocket. All right, what are we looking at here? Okay, what are these features on the bone? First of all, what bone is this? This is another scapula. Are we looking at the front or the back of the scapula here? Well, this is an anterior view, okay? All right, which makes this a right scapula, Okay, now, what feature is this? This little indentation right here. This is where the proximal head of the humerus articulates. This is the glenoid fossa. How about this big indentation here that's underneath the scapula looking at it from the front? That's the subscapular fossa. The subscapularis muscle sits in this little pocket, okay? The infraspinatus, the supraspinatus, the subscapularis, and the teres major are all what we call the rotator cuff muscles, and they're going to be a big deal when we start talking about joints a little bit later on. Okay, what are these features here? First of all, what bone is this? Okay, this is a radius, okay? Now, what is this here? This is the head of the radius. This is the proximal head, all right? What is this little pointy protrusion down here? Well, this is the styloid process of the radius on the distal head, And then finally, what is this bump right here? This is the radial tuberosity, okay? Now, what's the significance of each of these? Well, the proximal head of the radius is round so that it can roll over the ulna when you pronate and supinate. The styloid process of the radius forms the bump on the outside of your wrist in anatomical position. And the radial tuberosity is relevant because it is a point of attachment for the biceps brachii muscle. Okay, this is one of the movable parts of that particular joint, the attachment at the radial tuberosity. Okay, another bone. What bone is this? Okay, this is an ulna. How do we know? Because of this U-shaped proximal head, U for ulna. Okay. All right. What is this protrusion up here? This little bump. Okay. That's the olecranon process that forms the bump of your elbow. Okay. What is this little pointy protrusion down here? Well, that's the styloid process on the distal head of the ulna. Okay. So both the radius and the ulna have a styloid process, and they form the bumps of your lateral and medial wrist in anatomical position respectively. Okay? All right, what is this indentation here? Okay, this U-shaped indentation, that is the trochlear notch, and what sits in there is the trochlea, a pulley-like sort of groove on the distal head of the humerus. All right, finally, what is this little indentation here? This is the radial notch. And why is that a big deal? That's where the proximal head of the radius articulates with the proximal head of the ulna. Okay, this is what allows the radius to roll over the ulna when you pronate and supinate. All right. What is this roughened area here? First of all, what bone is this? Okay, this is a humerus. Okay, now, which is the anterior view? Which is the posterior view? Okay, well, this is the anterior view. How do we know? We can see the intertubercular groove, all right, and we can see the lesser and greater tubercle. Okay, these little bumps right here. The tendon of the biceps brachii runs right through there. Okay, this is the posterior view. The way that we can tell is that the divot on the posterior side of the distal head of the humerus is very deep. Okay, this is the olecranon fossa. This is what accommodates the olecranon that forms the back part of your elbow joint. All right. All right. So what is this roughened area right here? Well, this is called the deltoid tuberosity. The deltoid tuberosity. Now, why is that a big deal? Because it's a point of attachment for the deltoid muscle, a triangular shaped muscle on the top of your shoulder, okay, where you get vaccinations a lot of times. And this is a major muscle that allows you to abduct the arm. And you'll see it when we get to the chapter on muscles in a week or so. All right, this is a slide asking for the relevant bone markings. So first of all, we want to identify this bone, and this again is a humerus. Okay, this is a humerus, and we want to know here what we're looking at. Okay, this is the proximal head. This is the distal head. Okay, So this is the proximal head of the humerus. This bump down here, okay, is called the greater tubercle, and that's on the ventral aspect of the humerus, the front, the anterior end. And this here is the lesser tubercle. In between here is the intertubercular groove, and that's where the tendon of the biceps brachii runs. Right down here, this is a ventral distal view. How can we tell? Again, because we do not see that deep divot, okay, the olecranon fossa, on the anterior aspect of the distal head. Okay, so that makes this the lateral epicondyle, and this is the trochlea, which fits in the trochlear notch. Okay, the lateral epicondyle is called the lateral epicondyle because it sits above the lateral condyle of the humerus. And then down here, distal end, okay, is the olecranon fossa. Okay, this is only seen on the posterior aspect of the humerus, which means that this is the back of the humerus in this inset, which makes this a left humerus, What bone is this? Okay, this is your os coxa. Okay, is this a right or a left os coxa? And the answer is this is a left os coxa. And we're looking at the lateral view. Okay, so let's start up here. What is this ridge? This ridge is the iliac crest. Okay, what is this indentation here? This is the greater sciatic notch. It provides a passageway through which the sciatic nerve will run. Okay, moving down, this indentation here is called the acetabulum. This is a socket into which the proximal head of the femur will articulate, forming the hip joint. Okay, what is this hole down here? Okay, this is the obturator foramen. Okay, foramen means hole. And finally, what is this roughened area here? This is the ischial tuberosity. It's part of the ischium. This is the posterior aspect of the scapula here. This is the anterior aspect. This is the part of the ischium that you sit on. All right. Now, what are we looking at here? What bone is this again? Okay, and that's an os coxa, okay? All right, so first question we want to ask is this a right or a left os coxa? Okay, so how do we tell? Well, what can't we see from this view? And what you should not be able to see is the acetabulum, okay? Cannot see the acetabulum. Where would the acetabulum be in this bone? It would be basically under here, okay? So what you're doing is you're looking from the medial to the lateral aspect of the bone, all right? So we're getting a view of the inner surface of the hip in this picture, all right? So that tells us is that this is a right os coxa, And if this is a right os coxa, how can we tell the front from the back? Well, one of the things that we look for is a roughened surface that would indicate the point where the sacrum would articulate. And we see that roughened surface right here, okay, right here. And that is the articular surface for the sacrum, okay. What is this little indentation here? That is again the greater sciatic notch. And then this area here, all right, what joint does this region form? This forms the pubic symphysis. This is the joint at the front of your pelvic girdle, and it's important in childbirth in women because it has to soften up so that the baby's head can pass through the birth canal in order for you to give birth, okay? All right. Which of the labeled areas is the ilium, which is the ischium, and which is the pubis in this bone? Okay. Well, the big crest up top, that's basically the point of your hip. You can feel that if you put your thumb on your hip right now as you're sitting at your chair. Okay, that is your ilium. Okay, that is your ilium. All right. All right. Now, is this a right or a left os coxa? Well, this is the lateral aspect. Okay. There's the sciatic notch. There's the pubis. All right. So this is going to be a left os coxa. Okay. So what does that make number 2? What's number 2 pointing to? Number 2 is the pubis. Okay. That's the pubis. That's going to be in the front of the os coxa. All right. And what's number 3? Well, number 3 is the ischium. Okay. The ischium. That's the part that you sit on. All right. Moving on. What bone is this? Let's take 10 seconds. Okay, that is a femur. All right, now is that a right or a left femur? Well, how do we tell? We look at the distal head. Let's look at the distal head. What do we see? Well, with this distal head, we do not see the intercondylar fossa. All right, so that means this is the front of the bone. Well, since the proximal head always is going to point medially, this has to be a left femur. Left femur. Okay. All right. So let's move on to these different features. Okay. What is this feature here? This is the greater trochanter. This is the trochanteric fossa. Down here is the lateral epicondyle. This is the patellar surface. The patella, the kneecap, would articulate here. This is the proximal head of the femur, which articulates with the acetabulum of the os coxa, and this is the lesser trochanter. The lesser trochanter. Okay. And finally, this is the medial epicondyle. Now, you might ask, well, wait a minute now. What's the difference between an epicondyle and a condyle? All right. Well, the condyle is the part of the bone that actually forms the joint. Okay. In this case, the medial and lateral condyle of the femur, which is on the distal head, is going to articulate with the tibia, okay, with the proximal head of the tibia. The epicondyles are on top of the condyles, okay. Epi means above or upon, and so that's where the name comes from. So these guys aren't actually in the joint, not actually in the joint, okay. All right. Moving on. What bone is this? I'll give you 10 seconds. All right. That is a tibia. Now, is that a right or a left tibia? Well, how do you tell? Well, again, we have to look here at the distal head. And what do we see at the distal head? We see the medial malleolus, this little point right here. Okay? And so that's going to make this a left tibia. A left tibia. Okay? Another way that I can tell that we're looking at the front is, again, this little bump here, the tibial tuberosity, where the patellar tendon attaches. Okay? So that's going to tell you front from back, and this is going to tell you medial from lateral. Okay. Now, let's start up here. What is this feature here, this little indentation? This is the lateral condyle. Okay. This ridge here is called the anterior crest, and this is the medial condyle. The medial condyle. Okay. And then down here, the medial malleolus. The medial malleolus. Okay. Moving on. What bone is this? This is a tough one. This is the fibula. This is the lateral strut of your lower leg. This would be the proximal head, and this would be the lateral malleolus. Okay? Remember that the lateral malleolus is smooth laterally and it points posteriorly and inferiorly. Okay, so this is the bump on the outside of your ankle. All right, some questions. All right, is the radius medial or lateral to the ulna? The radius is lateral to the ulna. Is the fibula medial or lateral to the tibia? It is lateral to the tibia. Okay. Does the fibula articulate with the femur? No. Okay. The fibula does not articulate with the femur. It articulates with the tibia. Okay. If you look at an articulated skeleton, what you'll see, all right, is that the fibula never ever actually comes into contact with the femur. Okay. All right. What is the common name for the calcaneus? And that's the heel bone. Name two bones that articulate with the scapula, and that would be the humerus and the clavicle. Next question. Is the lesser tubercle on the anterior or the posterior aspect of the humerus? Okay. And the lesser tubercle is on the anterior aspect of the humerus. Okay. Next question. Is the lesser trochanter on the anterior or the posterior aspect of the femur? And the answer is the posterior aspect of the femur. Okay, finally, does the fibula articulate with the tibia? And the answer is yes, it articulates with it medially. Okay, medially. All right, now let's do some articulations. Okay. And what we want to do is for each of the structures indicated by the arrows on the following slides, name the whole bone that articulates with the structure. Okay, so first of all, what bone is this? This is the fibula. Okay, now, what articulates with this? What is this? Okay, this right here is the proximal head of the fibula. Okay, what articulates with it? The tibia. The tibia. Okay, it does not touch the femur. All right, down here. All right, this is the distal head of the fibula. Okay, forms the medial, or I'm sorry, the lateral malleolus. And what articulates with it distally? Okay, and the answer is the talus. The talus. Okay. All right, down here. What bone is this? Okay, this is a tibia. Is this a right or a left tibia? This is a left tibia. Okay, how can we tell? The medial malleolus right here. All right. So, what articulates with the distal head of the tibia? And that is the talus again. The talus. All right. Over here. What bone is this? Okay, this is a scapula. This is a left scapula. How do I know? I can only see the scapular spine from the back. Okay, so this is the acromion process here. Remember I told you it's on the ass of the scapula? What articulates with the acromion process? And the answer is the clavicle. The clavicle. Okay? All right, next question. What bone is this? This is your patella. This is your kneecap. Okay? And what bone articulates with the patella? And that's going to be your femur. Okay? And to some extent, your tibia. Okay? So both of those articulate because the patella kind of rides up and down, okay, between those two bones. All right, down here, what bone is this? This is the clavicle. The clavicle has an S shape to it, an S shape to it. All right, now what articulates with the clavicle here? Okay, and this is the manubrium over here on the right, and the scapula over here on the left. Okay, the clavicle is flattened laterally, okay, and it's smoother on the top than it is on the bottom. Okay, so what we're looking at here is a clavicle, and I believe that that's a right clavicle. A right clavicle. Okay. What bone is this? Okay, this is the coccyx. What articulates superiorly with it? The sacrum. Sacrum. Okay. All right, over here, what is this? This is a sacrum, this whole thing. All right, and what articulates with the sacrum superiorly? That's the lumbar vertebrae. The lumbar vertebrae. Okay. All right. What bone is this? Femur. Okay. And this is the front of the femur, again, because of the characteristics of the distal head. And is this a right or a left femur then? This is a left femur. What articulates with the femur here? The patella. Okay. What bone is this? This is a radius. Okay. And this is the proximal head of the radius, again, shaped like a dime. This is the distal head of the radius. What articulates with the distal head of the radius? The carpals. The carpals. Okay, what bone is this? This is an ulna. Okay, this is the proximal head. This is the distal head. This is the front of the ulna. Okay, ulna, remember, is the medial bone of your forearm. Okay, so what articulates distally with the ulna? And those are the carpals again. Okay, name two bones that are not tarsals that articulate with this bone. What is this bone? This is the talus. And what bones articulate with it? The fibula and the tibia, and they articulate with it proximally, up here, okay? All right, for each of the structures indicated by the arrows on the following slides, name the bone marking that articulates with this structure. Okay, the bone marking that articulates with this structure. So it's a very specific question, okay? They're not asking you the name of the bone marking in the arrow. They're asking you the name of the bone feature that touches this bone marking. All right? So let's start over here, okay? What articulates with this indentation, okay? And that's the mandibular condyle, okay? This is what forms part of the temporomandibular joint, okay? The mandibular fossa is what this feature is, all right? So don't confuse that on the exam. Don't think that they're pointing to this feature and they're asking you the name of that feature. They're asking you the name of the feature that articulates with this feature, okay? So mandibular condyle sits in that little socket, all right? All right. What articulates here? The superior articular process of the atlas, okay? What is this bump, okay? These are the occipital condyles, and this forms the joint that allows you to shake your head yes, yes. Okay, what bone is this? This is the mandible, the only movable bone of the skull, all right? What articulates with this structure, okay? And the answer is the mandibular fossa, because this is the mandibular condyle, okay? All right. What articulates with this feature? Well, this feature is the glenoid fossa, and what articulates with this is the proximal head of the humerus, okay? Okay. Next, it's asking what articulates with each of the arrows in each of the labeled bones. Okay, so let's identify each of these bones first. This is the acetabulum. I'm sorry. This is the femur. Okay, and this is again a left femur. We can tell because again the proximal head has no intercondylar fossa. This is radius. Okay, and we can tell. Remember that the radius is always going to be on the thumb side. The tuberosity is always going to be on the medial side, okay? So this is going to be a left radius, and over here, this is the anterior aspect of the ulna, okay? Proximal head of the ulna has a shape like a U, okay? And so what we're looking at here, you can see the trochlear notch right there. I'll give away one of the answers already. And so as a result, the radius is going to be lateral to that, all right, which is going to make this a right ulna, okay? So what articulates with each of these? So let's start with the femur up here. What articulates here? Well, the acetabulum of the os coxon articulates with it medially, okay? What articulates down here? Well, the medial articular surface of the tibia and the lateral articular surface of the tibia. And this forms part of the knee joint. Okay? All right. How about right here? Okay? Let's look at the radius. What articulates up here? Well, the radial notch of the ulna. The radial notch of the ulna. Okay? And what articulates at this little bump? And that is the biceps brachii tendon. Okay? Biceps brachii tendon attaches right there. Okay. Over here at the ulna, what articulates in this indentation? Well, that's the trochlear notch, and what articulates there is the trochlea. And this is the radial notch, and what articulates here is the proximal head of the radius. Okay? All right. Okay? These are just some more features. Okay? And what they're asking you here is what articulates with each of these, and you can see them labeled. The glenoid fossa articulates with the proximal head of the humerus. The olecranon process articulates with the olecranon fossa. The head of the radius articulates here, okay? And the trochlear notch articulates with the trochlea, okay? Okay, what bone is this? Okay, this is again an os coxa. And is this a right or a left os coxa? This is a right os coxa, all right? So what articulates here? The sacrum. What articulates here? The pubis, okay? Now, as you know, you're going to have a word bank to choose from, and that cuts both ways. It'll save you on spelling each of these, but it can confuse you because they're going to pick words to put in a word bank that are going to look and sound similar to the correct word for the process or the bone. Okay, so you want to be very, very particular about giving the correct answer. Okay, more alphabetical lists. Okay, now what I've got for you here is some very good websites to help you review skeletal anatomy. All right, so copy each of these down. I'll give you a minute, and I'll talk about these in the meantime. Maricopa, this top link here, is basically an interactive site where you can click on different bones of the skeleton and it'll give you the names. Okay, and it'll do it with actual pictures of bones as well as drawings. Down here, what you can see here with this particular website is again an interactive skeletal review. Okay, where they'll do some Q&A for you, and they also have some interactive graphics for you to help learn the skeletal system. All right, so be sure and visit these sites. They're excellent. They're also posted in the web resources section of Angel to help you review this material effectively. And please let me know if you have any questions or you want any extra practice. But again, I highly recommend going to Biosis, and I highly recommend practicing with this stuff. Okay, because you know now after you've taken this first practical the types of questions they're going to ask. Okay, I'll see everybody in class. Have a good evening.